Dear colleagues and MRCP aspirants, today I'm going to discuss one of the new tasks given in the PACES examination in the recent diet. They told to examine the motor system in a patient with Huntington's chorea or Huntington's disease. How to approach in such case? Actually, it is a real test for the colleague or for the candidates appearing in the exam. Because Huntington's patients, they are having these movements, they will be having the tremors and the chorea, so they will not be sitting comfortably, they will be having repeated movement, so it is very difficult to do the examination. But follow the systemic approach and follow the following tips, so you will proceed and you will do it confidently. And the question arises, why the motor system examination is asked in such case. So there are findings in such case. So they want to know your information and your knowledge about Huntington's disease. Especially in the late stages of the disease, the patient used to develop the muscular weakness. So they want to check two things: your clinical knowledge and how you apply for that, and how you manage such patient who is not cooperative. So how to approach and how to deal with such case, with such a case during your clinical practice and during examination. So how to approach in such type of cases. So when you are entering into the examination room, so as per routine, we have to wash our hands and introduce yourself, and you have to explain the patient that you are going to examine, and during the examination you will remain very polite. If you have any pain anywhere, let me know, and during the examination, if you feel any pain, also please inform me. So after the introduction and your permission for examination, you have to observe the patient. Obviously, such patient will be having many involuntary movements while they are sitting. So on inspection, you have to see choreiform movements, that will be irregular, jerky, involuntary movements of the limbs, of the face and the trunk. You have to observe also the facial grimacing. They are doing tongue protrusion, or sometimes they are doing the head jerking, head movements. You have to notice any abnormal postures that the patient is having while you are starting the examination, and you have to note this, and you have to explain why, and you have to present this while you are presenting your case. So after the inspection, as per routine, we are going to check the tone. So first we have to do the examination in the upper limb, for example, and then to the lower limb. So check the tone in the upper limbs. Ask the patient to relax and move the arm at the elbow and at the wrist. You have to move it, and you have to feel any hypertonia is there or no. So the positive finding is, in early stages of the disease, the tone will be normal, but in advanced stages, there will be increased tone, or the rigidity will be there. So it indicates that the patient is having Huntington's disease or the chorea of advanced stage if the tone is increased. After doing the tone assessment, you will check the power. You have to explain the patient that what you are going to do. Okay, so try to explain the patient. Check the power at the wrist joint, and then to the elbow joint, and then to the shoulder joint. So we have to check the power in the major muscles: elbow, wrist flexion and extension, elbow flexion and extension, and then the shoulder abduction. This will be enough. What could be the positive findings? So in early stage of the disease or Huntington's disease or the Huntington's chorea, the power is usually normal, but in advanced stages, the power will be reduced. And why it is reduced? It is reduced due to the muscle wasting. Okay, so after checking the power, we will go for the reflexes. We have to check the deep tendon reflexes, the bicep reflex, the tricep reflex, the supinator reflex. Reflexes may be brisk due to upper motor neuron involvement, or it may be normal in early stage of the disease. So these are the hidden agendas or the hidden findings that we have to pick up, and mainly these findings will be indicating that the disease is in advanced stage. Then we have to check the coordination, and again, sometimes it is very difficult to explain to the patient to follow your commands. So what we have to do in upper limb examination, we have to do the finger nose test. We have to ask the patient to touch the nose and then touch your finger repeatedly. So what could be the findings? The positive finding could be dysmetria, that is inaccuracy in the movements, or impaired coordination due to chorea. So this is in the upper limb, and same we have to do in the lower limb examination. The inspection, tone, power, reflexes, and the coordination. Coordination in the legs, as we know that we have to check by the heel shin test. So we have to see the cognition level and the intellectual level of the patient also, whether he is following the command or no. This also we should do during the presentation. We have to inform to the examiner about the intellectual status of the patient, whether he is following your commands or no. So it indicates that we have to check the intellectual level also of the patient during this examination, and we have to notify this. Okay, if we are doing the lower limb examination, so lower limb examination will not finish until we check the gait of the patient. We have to ask the patient to walk across the room, then turn and walk back. Better, you should be standing beside the patient while the patient is walking. Patient should not fall down. So during the gait examination, we have to check the choreiform movements during walking. Is there any staggering or broad-based gait is there or no? The positive findings could be gait may be unsteady, or it could be dancing like gait due to chorea. So these are the findings of the motor system examination in Huntington's disease or Huntington's chorea patient. Other signs that we have to notice that these eye movements, we have to test the saccadic movement and smooth pursuit. Patient may have impaired saccadic initiation or may have slow saccades. We have to check the speech of the patient, ask the patient to repeat some words. So the patient could be having dysarthria or irregular speech pattern due to chorea. Cognitive assessment is also important to do if we have the time. Briefly assess for cognitive decline. For example, the memory, attention of the patient, that you will do also while you are giving the commands to the patient. So these are the examination points in such case. What could be the positive findings in Huntington's chorea patient while we are doing the motor system examination? In summary, they can have choreiform movements, irregular, jerky, involuntary movements. They could have facial grimacing or tongue protrusion. They could have impaired coordination and dysmetria. They could have gait abnormalities, unsteady gait, or broad-based gait. The reflexes could be brisk reflexes could be there, and the rigidity in advanced stages. And also we have to inform that the patient is having cognitive decline and dysarthria also. So these are the important points that we have to find out while doing the motor system examination in Huntington's chorea patient. During the examination, we have to be empathetic and very much polite with the patient, and we should be having the confidence level, and we should have the patience because this patient will take longer time to follow your commands. The examiners notice this and they know that the patient usually they don't follow your commands as the routine case is following. So don't worry about that. Try to continue your examination systemically. We have to focus to find out the characteristic features of Huntington's chorea, that is the choreatic movements, the gait abnormalities, and cognitive decline. So this is all about this case. Thank you so much to have this, and continue to follow our YouTube channel of PACES Pulse Academy and join our PACES Pulse Academy WhatsApp group, so you will remain updated with our new teaching sessions and also teaching courses. Thank you so much again.
For more detailed explanations and related topics, we invite you to watch our videos on our YouTube channel. Don't forget to like, comment, and subscribe to stay updated with our latest educational content. Thank you.